My name is Allison Bakken, and I am a student member of the State Bar of South Dakota Lawyers Assistance Committee. The Pursuit of Happiness is a student organization at USD Law, and we work to basically do the same things that the Lawyers Assistance Committee does for lawyers in South Dakota. We try to help students recognize that they might be facing these issues. We encourage them to take care of themselves, to take care of each other, because we spend the most time with each other than anybody else in our lives. So it's super important that we recognize these signs in each other as well as ourselves. Please take a moment to learn how mental health, substance use, and addiction can impact our lives both personally and professionally. Together, we hope to make our profession thrive, improve the lives of those around us, and live above the bar.
Hello, my name is Pamela Ryder, and I'm president of the State Bar of South Dakota. And joining me today is Dr. Singh from Sanford Psychiatry. Welcome to the State Bar's Lawyers Assistance Committee's Living Above the Bar series, where we'll discuss a variety of health-related topics that impact us both personally and professionally. On this series, I'll be talking with Dr. Singh about ADHD and how that may impact us and how to recognize it and treat it. Thank you, Dr. Singh, for joining us today. Can you please tell us what is ADHD?
So ADHD is a disorder that usually starts in childhood. So individuals usually are diagnosed with symptoms of inattention or hyperactivity or a combination of both before the age of 12. So it is likely that you will have a young child who will be struggling at school, will struggle with schoolwork, with attention, focus, distractibility. They might be hyperactive. The presentation could be with hyperactivity. It could be a combination of hyperactivity with inattentiveness, or it just could be inattentiveness. As an individual ages, if you look at ADHD over a lifespan of an individual, as an individual ages, the hyperactivity symptoms generally tend to settle down. And as we look at young adults, we continue to see symptoms of inattention continue to be a problem. The hyperactivity problem will settle down. And so it is not uncommon for young professionals to come in with symptoms of depression and anxiety. And as I start having a conversation with them about what could be causing their depression and anxiety, we figure out that it is their lack of organization. It is their distractibility, not being able to keep up with work that is being given to them, that gets them really overwhelmed, and they feel constantly overwhelmed. They always feel like they are always trying to play catch up constantly. And these could be symptoms of ADHD. And if the symptoms of ADHD are not treated, the comorbidity of depression and anxiety that the patient comes in with will not generally get better.
Will there be periods of time where an individual with ADHD may do fine and not have this inattentiveness, but then there could be periods of time where it's pretty severe?
Generally, no. You will see symptoms of inattention constantly throughout their life. So as you start having a conversation with these individuals, you talk to them about their middle school years, their high school years, and you will notice this pattern that they were great. They did fine, they were active in sports, struggled a little bit with schoolwork, had difficulty turning in their assignments. They're usually the last one. They tend to procrastinate till the last minute to turn in the assignments. But they got through school. Then they go to college where there is a little less structure. That is when they start to notice that they tend to lag behind a little bit more. That is where the procrastination tends to catch up with them. Then they go into careers, and then as more responsibilities are thrust upon them, that is when you tend to notice that these individuals struggle a bit more. Then they're writing down stuff, they're writing down lists because they have to stay on top of everything, and their level of organization is not as good as what it was when they were younger.
If someone is having some of these signs and symptoms, what should they do?
If somebody is noticing symptoms of ADHD, they should start by having a conversation with their loved one. They should have, if they're not married or they don't have a significant other, they need to have a conversation with their parents. What were they like when they were a child? That would be very important information for your physician to have as they're assessing you for adult ADHD. So if you've never been diagnosed with ADHD, you were not diagnosed with ADHD as a child, you want to get that piece of information. You want to have that piece of information before you walk in. If you're married or you have a significant other, talk to them about what have they noticed. Do they think you're impulsive? Do they think you get bored easily? Do they think you have difficulty finishing tasks? If they are able to go in with you for your meeting with your primary care physician, I would very strongly recommend that they do that, because ADHD is a very clinical diagnosis and we tend to rely on the patient's history, but we also want collateral history that helps us diagnose ADHD.
If one receives a diagnosis of ADHD, what does treatment usually look like?
So treatment is a combination of pharmacotherapy. So there are very effective medications that can be used for treatment of ADHD, along with working on understanding what are your strengths and weaknesses. So I would very strongly recommend that you work with a cognitive behavioral therapist, do some mindfulness strategies to help you stay organized and on top of your day-to-day activities.
Thank you. And thank you for those of you who have taken the time to view this segment of our Living Above the Bar series. Take care.